Hello, everyone. It's Dr. Yurkiw here, and welcome to today's webinar on hip pain. And if you can just type in the chat, if you can hear me okay, just put yes there. You can use the chat during the webinar to ask any questions. I'll usually answer the questions towards the end, but today I wanted to talk about hip pain, and we have quite a few slides, so I'd like to start going through those slides right now. My name is Dr. Yurkiw. I've been in practice for 26 years, and most of those years were in Winnipeg. I was in Winnipeg for about 15 years. That's where I grew up. Then we moved to the Okanagan. My practice was in Penticton. And then more recently, we moved up to Kelowna so my children could go to university. And I've started a new practice here in Kelowna where the landmark towers are, the glass buildings close to Harvey, where the white bridge is going over Harvey Avenue. We have flexible hours. We are open on weekends, and we do see patients on Saturdays and Sundays at that clinic. So today we wanted to talk about hip pain. A lot of people come into the clinic with hip pain. Some of them, it's more recent. They have an acute episode of hip pain. Some people, it's been going on for quite some time and the hip is starting to degenerate or get arthritic. So we want to talk about these conditions today and then what can be done about it. So where does hip pain come from? Well, a common reason for hip pain is an injury to the joint. Sometimes somebody will fall or they'll have an impact injury to the joint. It causes trauma, the joint starts to swell up, and then that inflammation starts to irritate the nerves, it irritates the joint, and then that causes quite a bit of pain when the person goes to move. Poor posture and alignment can cause hip pain. So if you stand incorrectly, off to one side, sometimes people have had a knee injury or a foot injury, they're compensating and they're walking differently, their gait is affected by it. That can cause pain in the joint as well. Wear and tear can cause hip pain. So what we mean by wear and tear is arthritis in the joint. So the joint can wear unevenly. Sometimes we see one hip wearing out, the other one is okay because the one hip was used more than the other. So we'll see wear and tear or sometimes asymmetrical wear and tear in the joint. So maybe there's wear and tear on a certain part of the ball and socket. So we will take x-rays in the clinic or get x-rays that have previously been taken, and we like to use that as part of our assessment. And then there's inflammation in the joint or the joint area. That inflammation can cause pain and discomfort. Sometimes the structures around the hip can cause pain too, like there's sacs of fluid around the hip called bursa, and if those sacs get inflamed, that's called bursitis. So there's a number of different conditions that we see in the hip joint, and I wanted to talk more about that today. So to understand the hip joint better, we want to make sure that you know the anatomy and the physiology in the hip area. So as far as the anatomy and physiology, in the hip, there's the ball and socket. So right here on each side, there's a ball and socket. There's cartilage at the end of the bone. So the cartilage protects the bone on either side from rubbing against each other. There's a capsule or ligament that goes around that joint. And then there's fluid in between the bones called synovial fluid. So it's really important that the anatomy is proper in the hip joint because the anatomy allows the hip to function properly. There's muscles that are around the hip joint. So there's some large muscles, the gluteus medius, gluteus maximus, gluteus minimus. There's 3 large muscles in the back part of the hip. There's the quadricep muscles coming off the front of the pelvis here and going down past the knee. And then there's a tensor fasciae lata or muscle group on the outside part of the leg, and then the adductors on the inside part. So there's a number of different muscles that we see around the hip joint. And then from the muscles, there's tendons that attach into the hip area. These tendons cross the joint and attach on the other side of the joint. So sometimes if those tendons can get pulled or stretched, they can get sprained or strained, and that can cause pain in the hip joint as well. The ligaments can get stretched or strained. That can cause pain in the hip joint. And then of course the bursa, the sacs of fluid that are around the hip, if there's friction on those sacs of fluid, if the hip's not working right, it causes compression and friction on the bursa, then it gets inflamed and it's quite painful. So what are the most common conditions we see in the clinic? Well, sprains and strains are the most common conditions. And people have an injury, an accident, they go too far maybe, they're playing a sport, or they slipped on some ice and their leg slips forward, it stretches the hip. That's a sprain or a strain. And if it just happened, we call that an acute episode. So acute sprain or strain, people will come in within a few days or a week or two after the injury. They're in pain and discomfort. It's quite easy to treat that, give them the right advice, and get them feeling better. If it's more chronic, so if it's been going on for a long period of time, then it's a little bit more difficult. The other thing that I wanted to mention here on this diagram is, in addition to all the muscles that are going through the area, there's some large nerves coming through the hip region, the biggest one being the sciatic nerve. The sciatic nerve comes from the low back and the sacrum. It forms the five nerve roots coming out of that area form the sciatic nerve and then travel through the hip area down to the feet. It actually crosses by one muscle here called the piriformis muscle. Sometimes that piriformis muscle can interfere with the sciatic nerve or cause pressure on that nerve. Arthritis. Well, what are the most common types of arthritis that we see in the clinic? Osteoarthritis being the most common type of arthritis. It's an arthritis that is from wear and tear. So if somebody has a hip problem, it's been there for a long period of time, the joint will start to wear unevenly, and then that'll cause breakdown of the cartilage and the synovial fluid and the bone. So we can see this on an x-ray because we'll see a narrowing of the joint space. When we take the x-ray, we'll see a sclerosis or a whitening of the bone on either side of the joint. And we can tell that the arthritis or the osteoarthritis has been there a long time. Other conditions that we see, rheumatoid arthritis, that is more of a systemic arthritis. Sometimes there's a hereditary component to it or familial component. Rheumatoid arthritis affects a number of different joints in the body and it can be at the same time. So there can be flare-ups of the joints during rheumatoid arthritis episodes. We want to help the patient to restore the movement in the joint. We want to improve the alignment, reduce the pain, and we want to manage those episodes so that it doesn't cause breakdown of the joint or long-term deficit of function. The third type of arthritis we see is psoriatic arthritis. Psoriatic arthritis is linked to psoriasis, and it's the third most common arthritic condition that we see. It's not as common as osteo, which is the most prevalent, or rheumatoid, but sometimes we do see patients with psoriatic arthritis in the clinic as well. Bursitis. Well, there's sacs of fluid around the hip, and we want to make sure that there's no friction on those sacs of fluid. If the hip is not lined up properly, it's not functioning right, then the muscles get pulled in or outwards. They can start to rub on those sacs of fluid and cause friction. And that friction can cause inflammation of the bursa. And when the bursa inflames, it can be very painful. It can be painful to move. And sometimes bursitis is a little different than sprains or strains or other types of injuries to the hip area because bursitis can irritate the person at nighttime as well. So one of the key questions I like to ask during a history is, are you having this pain at nighttime? And where is the pain located? If it's located close to a bursa, and there's pain, excuse me, pain at night, and it's affecting certain movements, then we'll include a diagnosis of bursitis. So when you have hip pain, which activities are most affected? Well, walking, number one, and what we see is people kind of limping when they have a hip problem. They're compensating by putting more weight on the other hip. So they kind of waddle a little bit. They kind of have a short stride on the affected side and a longer stride on the non-affected side. People with hip problems also complain about going up and down stairs. It becomes very painful because your hip has to flex into an angle, and that really puts a lot of strain on the ball and socket joint. So going up and down stairs can be very difficult. Getting in and out of the car, often patients say, you know, just getting their legs into the car or out of the car, that movement can be quite painful for the hip. Often I'll give patients advice to put the legs together, swing the legs into the car, and then when you're coming out of the car, the legs together, swinging the legs together, and kind of rotate the pelvis to be able to stand up and get out of the car. So that's one of the early recommendations that I make to patients to assist them to cope with the hip pain. And then lying down can be difficult, getting in and out of bed. Sometimes I see the patients having difficulty in the clinic where they're trying to get on our tables or get off the table. So I like to look at the posture and the alignment of the person. And one of the postures that I look at is front to back. If the person is slouching forward, it can affect the low back and it can affect the hip area as well. So when the person has this type of posture here on the left, it causes sprain or compression to the low back, but it can also change the angle of the hip joint, put more pressure in certain areas of the hip. We want to assess their posture front to back, but we also want to assess their posture side to side. So we want to make sure that they're carrying their weight evenly right to left and not more on one side or the other. If we see abnormalities with the posture and the alignment, we want to help the patient not just in the hip area, but we want to make sure that their alignment of their spine is balanced right to left. And if there's any problems in the knees or the feet, we want to make sure that those joints are functioning properly too, because if they're not, they can put extra strain or stress on the hips. So what can we do to help people that have hip pain? Well, one of the things we do when people come in is we do a history. We want to find out what caused the hip pain and if there's any family connection. We want to find out how many episodes they've had and how long it's been there for and what type of character the pain has. So all of the clues that we get from the history help us to narrow down the possible diagnosis for the hip problem. We want to do an assessment, and the assessment includes ranges of motion like this person's doing for the patient. So we want to check flexion and extension. We want to check rotation of the hip, abduction and abduction, which is bending the hip outward and inward. And we want to basically see which movements cause hip pain. We want to compress the joint and find out if that causes hip pain. We want to distract the joint or basically pull on the joint a bit to see if that causes pain. All of these different orthopedic tests tell us more about what the diagnosis could be. Sometimes with that assessment, depending on the factors, if there's some red flags, we can take some x-rays. We have a digital x-ray unit in the clinic. We'll take x-rays of the hip or the lower part of the spine, the hip region, to find out if there's any arthritis or degeneration or anything else that we should know about that patient's condition. And then we want to do treatment. Now, treatment in the hip area can include hands-on adjustments. It could include instrument adjustments. It could include table adjustments. So we use a number of different treatments in the clinic to restore the alignment and the function of the hip. We want to give patients advice for to take home. Initially, if the hip's swollen and the problem just happened, we want to give them advice like icing the joint. It is quite a thick joint, so We want to be careful of where the patient puts the ice pack, but icing for 10 minutes, doing that 3 to 5 times can reduce the swelling. If the patient has had the problem long-standing, it's a chronic condition, then what we want to do is usually encourage the patient to put some heat on it. And the timing of when they put the heat on it and how much they put the heat, that's something that varies from patient to patient. So we give the patient advice, we give them recommendations as far as how they should be sleeping, what activities they should be doing, just to help them to be a little more comfortable and to help in the healing process. Then we follow up with the patient. Depending on how bad the problem is, we'll follow up the next day or two, check the alignment and the function, then do another treatment if necessary. Often it's like 2 steps forward and 1 step back as we're progressing through the treatments. Some of the lifestyle changes that we like to recommend for patients are improving their posture. So working on keeping a better alignment so it's more well balanced front to back and right to left. Also, things like yoga and stretching can really help. Once the patient has progressed through the initial treatments, they can start to do some things themselves to help in that process. So yoga is really good for that. Certain types of stretches that we give patients can help. And then nutrition can be very important. Nutrition, if the joint's breaking down or if there's weak bones in the area, we recommend calcium, some joint supplements like some chondroitin sulfate for the joint, or we can recommend things like omega fatty acids that can help with the joint health and just to help in the repair process. We want to advise patients on having a healthy body weight. So sometimes excessive weight can cause faster wear and tear of the joint. So the BMI or the body mass index is something that we do discuss with our patients. We want to talk about stress management because if people are stressed, it causes more inflammation. We talk about exercise with our patients, what types of exercise to do. Sometimes I find with hip problems, I like to recommend that people do swimming or they can just walk in the pool. So just kind of walking in the shallow end, it's hard to do right now with the pools closed, but if you have an outdoor pool or you can eventually get into a pool, I suggest walking in a pool to help with the hip joint or doing some activities that are non-weight bearing. That could be like riding a stationary bike or bicycling, things that don't involve a lot of impact to the joint. And then another thing that we talk to patients about are shoes and proper footwear. Having enough cushion in the joint and then having the right arches in the feet can help because sometimes if the foot's not working right, it can translate up the chain to the knee and the hip as well. If you have hip pain, definitely call our office or you can message us to find out how we can help you. So we are taking new patients and usually we're able to get a patient in the clinic within 24 hours. So you can message us on social media at the phone number below, or you can just call the number and book an appointment. We are taking people right now as new patients, and we do have appointments available on the weekends, on Saturdays and Sundays. Our address is 105 1628 Dixon Avenue. That's the tall glass towers, the landmark 4. And my email address is drkerryyurkiw@gmail.com. If you have any questions, don't hesitate to send me an email, and or you can type a question in the chat right now. On social media, we have our website at kerryyurkiw.com. We do have a YouTube channel. We put a lot of these videos on our YouTube channel, so you can go and see videos on knee pain, on wrist pain, back pain, other webinars that we've done. We do have a podcast. It's on Apple Podcast and Anchor called Super Healthy. So make sure you listen to our podcast and subscribe to the YouTube and the podcast channel, because we're always talking about different things that people can do to help themselves with their health. You can follow us on Facebook. Our page is Dr. Kerry Yurkiw. On Instagram at Dr. Kerry Yurkiw, and on Twitter at Doc Kerry. I did write a book. I wrote one on back pain and one on neck pain. If you're interested, it is on Amazon. So you can go on Amazon and type in back pain in my name, and then you'll see the book. You can borrow it in the Kindle Unlimited program. You can also get a paperback or an ebook version. There is an audio version on Audible. So there's a few different versions of it, and there is one on neck pain as well. The upcoming webinars that we have, if you go to our Eventbrite page, type in Yurkiw Chiropractic, you'll see these webinars coming up, and they're always being updated. So we have one on foot pain coming up on Saturday. We do have one on wrist pain on Monday, stretches for back pain the Monday after that, and then advanced stretches and exercises for back pain. These ones are very popular, the back pain ones and the stretching. The foot pain and the wrist pain, we haven't done those before, so those are new for us. So there still is space. You can sign up for those webinars. Go to the Eventbrite page, click on the webinar you want to attend, and you'll get a ticket, and then we'll email you a link and a passcode just like we did for this one. If you want to come to the clinic, you attended this webinar, we are giving a special discount right now, and that is 10% off the initial appointment. This coupon is good until September 20th, so there's still a few days to take advantage of that. And use the code hip pain. So when you go online to book that, or you call into the clinic, tell them you're at the webinar, you've got the code hip pain, and we'll take 10% off that initial assessment. If you have any questions, please type them in the chat window below. I'd be happy to answer those questions for you right now. If you don't, you can certainly email me, or you can come to the clinic and ask those questions, and we can discuss your specific problem when you do come. I want to thank you for attending the webinar tonight. We will have a recording on YouTube tomorrow. So if you'd like to review it and watch it again or share it with some friends, make sure you go to YouTube, type in Dr. Kerry Yurkiw, and then you'll see this recording right at the top of the list. Have a good evening, and thanks for joining us.